Um, and then, in terms of other things that are going on, there are many, many trials that are still ongoing right now. I think data on the Bruton's tyrosine kinase inhibitors is just starting to come out. We had the first readout for the evobrutinib clinical trials in relapsing MS, and as you know, the results were very disappointing. Evobrutinib did not show superiority over teriflunomide in relapsing MS patients. And so we have to wrestle with that and what the implications of those observations are for the other clinical trials that are still ongoing. And so we've got a trial with remibrutinib, a couple of trials with fenbrutinib, and a couple of trials with tolebrutinib. And, I think, everybody's utilizing more or less the same approach with their BTKI. And I think people are hoping that what happened with evobrutinib will just be something that happened with evobrutinib. But I worry about that. You think about MS therapies and you ask yourself a question, well, within a class of drugs, such as S1P receptor modulators or fumarates or anti-CD20 monoclonal antibodies, or even the interferons or glutarimers, are those drugs more or less the same and similar to each other, or are they more different from each other? And I would say within a class of medications to date, so far, all the products are more similar to each other than different. And so I would be actually very surprised and extremely happy if all the other trials were extraordinarily successful, because we clearly need better therapies for our patients. But I do worry that the evobrutinib trial was a canary in the coal mine and is going to tell us something unfortunately disappointing for at least the relapsing studies with these other Bruton's tyrosine kinase inhibitors. So that takes us to, where to go next. And I think there's some very exciting work, which is just starting, looking at even more effective B-cell depleting strategies in MS, such as the CAR-T approach and many others. And I think there's still obviously a tremendous amount of work to be done. We still don't understand the fundamental pathobiology of what constitutes progressive MS, what that underlying pathoetiology is. I mean, we know what the damage that occurs, but exactly how it occurs and what underlies progression, in my mind, is still mysterious, and we haven't yet fully understood those underpinnings. And I think until we really understand the biology, it's going to be very challenging to find drugs that truly target the disease, whether you think it's maybe microglial activity or mitochondrial dysfunction or fibrinogen deposition. There are a lot of different theories, but they're all not the same. And so ultimately, we're going to have to really understand what the fundamental biology is in order to have treatments that, in my mind, are going to be highly effective for treatment of progression. Bewildering how the number of trials that are actually being conducted right now that are either active and recruiting or active and fully recruited. There are about 700 studies, such studies on clinicaltrials.gov, covering the full spectrum of drug trials to physical therapy interventions to observational studies and so on. Tremendous amount of work being done, and I think the fact that there are so many studies that are ongoing bespeaks well to progress, because even when we fail, we learn from our failures, right? And when we get a really strong success, well, that's fantastic. It's transformative to the field. So I think we're heading in that right direction, and it's wonderful to see so much work being done by so many brilliant minds applying themselves to solving MS.